Polio. Polio, also known as poliomyelitis, is a highly contagious disease caused by a virus that attacks the nervous system. Children younger than 5 years old are more likely to contract the virus than any other group, according to the World Health Organization, WHO. 1 in 200 polio infections will result in permanent paralysis. However, thanks to the Global Polio Eradication Initiative in 1988, the following regions are now certified polio-free: Americas, Europe, Western Pacific, Southeast Asia. The polio vaccine was developed in 1953 and made available in 1957. Since then, cases of polio have dropped in United States. Healthgrove graphic. But polio is still persistent in Afghanistan, Pakistan, and Nigeria. Eliminating polio will benefit the world in terms of health and economy. The eradication of polio can save at least $4.050 billion over the next 20 years. Symptoms. It's estimated that 95 to 99% of people who contract poliovirus are asymptomatic. This is known as subclinical polio. Even without symptoms, people infected with poliovirus can still spread the virus and cause infection in others. Non-paralytic polio. Signs and symptoms of non-paralytic polio can last from 1 to 10 days. These signs and symptoms can be flu-like and can include fever, sore throat, headache, vomiting, fatigue, meningitis. Non-paralytic polio is also known as abortive polio. Paralytic polio. About 1% of polio cases can develop into paralytic polio. Paralytic polio leads to paralysis in the spinal cord. Spinal polio, brainstem bulbar polio, or both bulbospinal polio. Initial symptoms are similar to non-paralytic polio, but after a week, more severe symptoms will appear. These symptoms include loss of reflexes, severe spasms, and muscle pain, loose and floppy limbs, sometimes on just one side of the body, sudden paralysis, temporary or permanent, deformed limbs, especially the hips, ankles, and feet. It's rare for full paralysis to develop. Less than 1% of all polio cases will result in permanent paralysis. In 5 to 10% of the polio paralysis cases, the virus will attack the muscles that help you breathe and cause death. Post-polio syndrome. It's possible for polio to return even after you've recovered. This can occur after 15 to 40 years. Common symptoms of post-polio syndrome (PPS) are continuing muscle and joint weakness, muscle pain that gets worse, becoming easily exhausted or fatigued, muscle wasting, also called muscle atrophy, trouble breathing and swallowing, sleep apnea or sleep-related breathing problems, low tolerance of cold temperatures, new onset of weakness in previously uninvolved muscles, depression, trouble with concentration and memory. Talk to your doctor if you've had polio and are starting to see these symptoms. It's estimated that 25 to 50% of people who survived polio will get PPS. PPS can't be caught by others having this disorder. Treatment involves management strategies to improve your quality of life and reduce pain or fatigue.